Okay, good morning, everyone. My name is Connie Nettles, and I'm a nurse practitioner student at Auburn University. And today I will be completing a head-to-toe assessment on this gentleman. First off, we're going to start by doing a scope around the room. With the ceiling and the floor. All right, so prior to coming into the room, I've already washed my hands. I've introduced myself to the patient. I did a chart check outside and we collected vital signs. So his blood pressure, pulse, respiration, temperature, oxygen saturation, height, weight, and BMI were all within normal limits. Also was able to visualize him engaging with staff. And his mood was appropriate, his behavior was appropriate, and he was able to hold a casual conversation with staff. He did not have any slurring of the speech, there was no stuttering, and he also was visualized walking into the exam room, and his gait was normal. He did not limp, he did not trip, fall, he did not drag a limb, and he did not use any assistive devices. Getting up on the exam table today, he did not require any assistance. So first I'm going to do a general appearance. He appears well nourished and no acute distress. His body habitus is well developed and his posture is slightly slanted forward. His sexual maturation appears normal, and I don't smell any obvious body odors, and he's dressed appropriately for today's exam. First off, I'm going to start by asking you your name.
Justin.
And where are you today?
Tallahassee, Alabama.
And do you know what year it is?
2021.
And who is the president?
Joe Biden.
Okay, so the patient is alert. He's oriented to person, place, time, and situation. And for this exam, I'm going to be only focusing on one side of the body, so a unilateral approach to save time. And I'm also going to maintain privacy and modesty, so we will not be removing any articles of clothing. Throughout this entire exam, I will be assessing the skin, and I will be assessing for any lumps, bumps, lesions, any rashes, any edema, if he has any masses, any scars that may be noted, or if he has any sutures in place. So we'll be doing that throughout the exam. All right, we're going to start with the head. And here with the head, I'm going to be inspecting while I palpate, and I'm inspecting for any lumps, bumps, any depressions, and I don't see anything there. His head is atraumatic normocephalic, and his hair is nice, it's fine, it's well distributed throughout. Don't see a big receding hairline, and there's no graying that I'm noting at this time. Next, we're going to move on to the face. The face is symmetric. His eyebrows are symmetric, eyes are symmetric, ears. His nose is at a good angle, and his mouth is symmetric. There is no drooping of one side of the face. I don't see any obvious twitches. Next, I'm going to be checking for TMJ. So if you will, open, close, close, good. And I didn't feel any clicks there. Next, we'll be checking cranial nerve number 5, and I will get you to clench your jaw real tight. Good, and that muscle was nice and strong. Next, we're going to be checking sinuses. So I will do frontal and maxillary. Any pain or tenderness?
No.
Good. And now I'm going to be checking his lymph nodes. So it's preocular, postocular, occipital, preorbital, mandible, premental, cervical chain, I talked to John, and subclavicular. Okay, and did you have any pain there? Good. Next, we will be completing an eye exam. So first off, we're going to be looking at the eyes, eyebrows, eyelashes, eyelids. His lacrimal ducts are not draining any fluid. His cornea, his iris, and the sclera. The sclera is white. There is no redness or jaundice noted. Next, we're going to start some eye tests. So the first one is going to check cranial nerve 2, and we'll be doing the Snellen eye chart. If you can hold that out one eye at a time and read the lowest line,
LTFPH.
and the next line.
LTFPH.
And if we had a eye chart that was at a long distance, we would be checking his farsighted also. Okay. So I'm going to start by checking pupil response. Okay. And if you can, look at my ophthalmoscope and move it forward. Good. So he has, his pupils are equal round reactive to light, and it accommodated whenever he looked at my ophthalmoscope, and his pupils were a size 2. Next, we're going to do the confrontational test. So if you can cover one eye for me, look at a long distance. Or look at my nose, actually, I'm sorry. And tell me what number you see.
2.
Good. And then we're going to do the cover test. So if you will look at a far distance, cover one eye, and then cover the next. Good. And there was no stigmas, and his eye did not deviate at all. Next, we're going to check cranial nerves 3, 4, and 6 with the 6-point of gaze. So if you'll follow my finger. Okay. And he was able to follow throughout that test. Okay. So next we're going to be checking internal eye. I will be using his right eye, so I'll be using my right eye, my right hand. The light is on and it's at the lowest setting. Okay, and typically we'll do this in a lightly dim room, but for this exam, we were not. And I was checking for his cornea, the optic disc, his retinal background, retinal vessels, and that red reflex. All right, next we're going to move on to the ears. And I'm going to first inspect the ears. Any pain there?
No.
Press on the tragus, any pain there?
No.
Okay, and we're going to do what's called a whisper test. So I'm going to say a few words and you repeat them back to me.
What?
Sorry.
Red 5 truck.
Very good. And next we'll be completing the Weber and Rhine test, and this is cranial nerve number 8. And the first test, I want you to tell me if you hear this in one or both ears.
Okay. Both.
Okay. And the next, I'm going to get you to tell me when you hear the sound stop. I don't think I hit it hard enough.
Yeah,
I'm sorry.
stop. It stopped right when you took it off.
Yeah. Stop.
Yep.
Tell me when it stops.
Still going. Still going. Stop.
Okay, So that was appropriate. Air conduction should be longer than phone conduction. Next, we're going to check internal structures of the ear. Line it off down. Can get it to work. Okay, so everything appears normal. He does have some mild amount of yellow cerebrum in the ear. His tympanic membrane is intact. It's not bulgy. It's not ruptured. There's no bleeding. There's no drainage noted, and the tympanic membrane was a translucent pale gray. Next, we'll be checking the nose. First, we're going to check for any pain. So I'm going to just palpate any pain there.
No.
Okay. And the nose is well defined and is symmetric. If you will, lift up your face. Look to the ceiling or look inside. Okay. All right. His mucous membranes are intact. They are moist and pink. There is no drainage noted. There's no lesions and there's no bleeding. Next, we're going to check olfactory nerve. So if you will close your eyes, I'm going to put a common scent in front of your nose and you just tell me what you smell.
Ooh, alcohol.
All right, so his olfactory nerve is intact. I'm going to check cranial nerve number 7 now with the face. If you will smile, frown, raise your eyebrows, and puff out your cheeks. Good. And that's all intact. Next, we're going to move to the mouth. His lips are symmetrical. They're nice pink. There is no cracking that I can tell. Can you look at your mouth? All right, can you open your mouth for me? When we say lift up your tongue. Good. So his his ducts are all there. His mouth is moist. His mucous membranes are intact. They are nice and pink. There's no missing teeth, no obvious cavities. His uvula moved up, so cranial nerve is there. Cranial nerve 9 is intact. Cranial nerve 10 is the glossopharyngeal, where I would check gag reflex, but we're not going to do that today. And I was able to visualize his tonsils, and they are adequate too. All right, next we'll be checking neck. And I'm just going to feel on the neck any pain.
Oh.
Trachea is midline. I'm going to check thyroid. You will swallow for me. Okay, and swallow again. Good. Thyroid does not appear to be enlarged, and I don't feel any obvious masses. Are you able to shrug your shoulders and move your head side to side? Good. Can you shrug your shoulders and with me press down? Good. All right, so that is intact. That's cranial nerve number 11. Next, we're going to move to the chest. And here I see that he is breathing normal. There is non-labor. He's not using any accessory muscles to breathe. I don't see any obvious deformities here. I'm going to start with his the posterior back, and I'm going to just inspect it. Again, the shirt would be off in a normal exam. We're going to do a nice thorough skin assessment here. I'm also going to just palpate down and down the spine. Any pain?
No.
Okay, I'm going to check for CVA. And if that was positive, the patient would have almost jumped off the table. So that is normal. I'm going to check, if you will, take a deep breath in. And that is symmetrical. Next, I'm going to percuss. And a nice resonant sound is noted. I'm going to listen. If you will, just take deep breaths in and out. Very good. I'm also going to check over forgot the name. If you will, say the word 99 multiple times.
99, 99, 99, 99,
Very good. And that was on tag. Say it again.
99, 99, 99.
Good. If you will straighten. And I'm going to press again. Well, I'm going to first inspect. I don't see anything. Because that was all good. Now listen again. Deep breaths in and out. Very good. All right, next we're going to move on to heart. So I'm going to just feel where your cardiac pulse is. So aortic, pulmonic, Herbst point, tricuspid, mitral. Okay, and while he's sitting up, I'm going to listen. You don't have to breathe, just breathe normal. And I'm also going to get you to lie back. And I'm going to listen again. And this time I'm going to listen with my bill and diaphragm. Listen to the aorta. And then listen to your carotid arteries. And that's with my bell. Okay. While he's lying here, I'm going to feel for JVD and feel his carotid arteries, the carotid pulse. Now with JVD, if I had a measuring tape, I would be able to measure his jugular pressure, and if it was between 3 and 4.5, that's normal. Also going to fill up your temporal artery, and that is normal. Okay, and with the heart sounds, I heard S1, S2, no S3, no S4, no rubs, gallops, and murmurs noted. Next, we're going to move on to the abdomen. Yeah, I'm going to inspect the abdomen. I don't see anything that is pulsating, and I forgot to mention the aorta. There was no murmur there noted, or any brewing in carotid arteries. There was no brewing there. Excuse me. So I'm going to inspect the abdomen. It is nice. It's got a little bit of roundness, but it is soft, and it's not distended. I'm going to do a skin Turner test to see about ascites, and I didn't feel any ascites there. Again, no pulsatile masses noted. I'm going to now listen to his abdomen. And he has positive bowel sounds. There is no tinkling bowel sounds noted. So he's got good peristalsis throughout his quadrants. Next, I'm going to percuss. Okay. And I'm going to feel if his liver is enlarged. So if you'll take a deep breath in, out. Good, and I don't feel an enlarged liver. Whenever I percuss over the liver, I should hear dullness, excuse me. And the spleen should not be palpable. If it is palpable, then he may have some splenomegaly going on, acromegaly going on. Next, we're going to do light palpation. And then deep. And I'm also going to be watching his facial expressions throughout that, and he did not have any grimacing. There was no, he didn't flinch in pain, and he was not trying to keep me away from doing it with his abdominal muscles. Next, I'm going to look at his skin. Since I'm standing right here, his skin is nice, warm, dry. There is no tinting. His color is appropriate for ethnicity. His nails are nice flat. There's no clubbing noted, and his capillary refills are less than 2 seconds. So that's good. I'm also going to fill up his radial pulse up till dorsal pedis and his pedal. Also, the femoral artery, we'll palpate for it. And that feels normal. With his abdomen, I didn't hear anything abnormal, like any bruise, any murmurs, nothing like that. So next we're going to move to musculoskeletal. So while he's lying down, I'm going to go ahead and check the ankles. So if you will, can you bring your toes up towards your face? Okay, now point them. Now bring them up with the resistance, push them down with the resistance. Can you roll your ankles? Good. With your knee, can you bring your knee to your chest? Good, and let it out. And now bring it in again, and we're going to do it with, yep, perfect. Okay, can you lift your leg up, straight up? Good, and lift it down. And with resistance, can you lift it up again? Okay, and let it down. Perfect. All right, are you able to put your knee across, your leg across? Yeah, perfect. Okay. Good. And now we will sit up again. With the cervical, can you tilt your head side to side, up and down? Okay. Push against my hand. Perfect. Are you able to just kind of like roll your neck a little bit? Good. With your shoulders, can you lift your arm up, lift it down, put them behind your back, behind your head, across your chest? Perfect. And then with the elbow, are you able to bring it in and let it out? Good. And I'm also feeling for any crepitus, and I don't feel any there. With your wrist, are you able to flex and point? Good. And roll it around. Good. Spread your fingers. Good. Close them. Make a fist. Good. Spread your fingers again. Don't let me close. Okay. And close them. And now try to open. Good. Perfect. All right. So all that was intact, and I didn't feel any crepitus in any of his joints. And was there any pain? Good. So next we're going to check reflex. So I'm going to check bicep. There you go. And tricep. Good. Brachioradial. Good. We're going to check his knee. Good. And then Achilles. Good. And then I will check for Babinski. that it tickled him, but he did not have a positive Udinsky sign. And then, I'm sorry, if you'll write back one more time, I'm going to check reflex of the abdomen. Okay, and there was positive reflex. Next, we're going to do some sensory tests. I'm going to put something soft on different parts of your body. I want you to close your eyes and tell me what part of the body that it's touching. Tell me what part of the body I'm touching.
Front of my leg.
Right leg.
Yeah, right leg.
Okay.
The top of my left arm. On top of my forehead. Top of my right arm. Chin. The front of my left leg. The cheek on the left side. and Cheek on the right side.
Okay. While I got you with your eyes closed, tell me if it's soft or if it's hard.
Soft. Hard. Soft. Hard. Soft. Hard. Hard.
Okay. With your eyes closed, open your hand and tell me what object I'm putting in your hand.
It's like a quarter.
Okay, very good. And now I'm going to draw a number in your hand and you tell me what number you feel.
6. 0.
Very good. You can open your eyes. The last thing we're going to do is check balance. So if you'll stand up. You'll walk right here. You walk normally. Okay, and on your way back, walk on your tippy toes. Keep going, keep going, keep going. Good job. And then can you do a heel toe walk?
What's that?
Heel to toe.
Oh, yeah.
Very good. All right. And then with your eyes closed, feet together, we're going to make sure that you don't fall. You got your balance.
Mhm.
And he is not having any slanting issues. You can open your eyes and have a seat. At this time, I believe that concludes my head to toe assessment. Thank you very much.
That was really good.